Well, a CDC study is giving us a first look at youth risk behavioral trends since the start of the pandemic. One of the main findings, teen girls in the U.S. experience more violence, suicidal thoughts, and mental health challenges, all in comparison to teen boys. And joining me now is Dr. Michelle Berk, child and adolescent psychologist at Stanford Medicine. So, Dr. Berk, thanks for joining us. Why do you think girls are experiencing these things more than boys are?
I think it's hard to know for sure why girls are experiencing higher rates of depression and suicidal thoughts than boys. But I think even, this data was collected during the pandemic, which I think had a huge impact on the mental health of all teens. And we know that girls, even before the pandemic, have higher rates of depression than boys and tend to be more vulnerable to that, potentially because of different hormonal changes that go on during adolescence and puberty. And so I think girls are more vulnerable in general. And then the impact of the pandemic, which is, during which this data by the CDC was gathered, has been, I think, predominantly negative for most teenagers and impacted a lot of areas of life for teenagers that have a big impact on their mood and their functioning, like school and peer relationships. And this data was collected during the height of the pandemic in 2021 when teens' lives were being significantly disrupted.
And what signs can parents look out for, and when should they actually say something to their child if they do notice something?
I think parents should feel free to ask their kids at any time how they're doing, or if they may be having suicidal thoughts or thoughts of harming themselves. There's really no data to suggest that it is dangerous in any way to ask your kids about these things. And it's important for kids to know that parents are willing to hear whatever is on their mind and are there to be supportive and to help. So I think asking and being open to hearing what kids have to say without judgment and being willing to help is a really important thing that parents can do to help protect their kids.
And are there more concerns within the LGBTQ community or plus community? And if there are, why is that?
Well, according to the data from the CDC, yes, kids who identify as LGBTQ have more challenges across the board in terms of their mood, suicidality, self-harm, and they're also more likely to be victimized. And I think they're in a challenging situation because of some of the discrimination that still goes on that causes them significant challenges, makes them much more vulnerable to mental health concerns.
And you had mentioned that study was done during the pandemic. So how much was this, due to isolation? How much is this toward social media? Are these the trends, or do you see it getting better?
I think the pandemic really exacerbated a lot of the risk factors that teens already face for mental health challenges in terms of isolation, academic challenges, peer challenges. All of the things that give their life meaning and the things that really impact their mood were disrupted during the pandemic. And when those things lead to feelings of hopelessness or intense self-criticism, feelings of lack of belongingness, then teens become much more vulnerable to depression, but more than that, to thoughts about suicide or suicidal behavior.
Yeah, indeed. The pandemic definitely exacerbated a lot of things. So, Dr. Michelle Berk, thank you very much with Stanford Medicine. Always good information, and thanks for joining us.
Thank you.